The treatment discontinuation is an important topic because for the longest time when we started using the tyrosine kinase inhibitors, we always said that they were very effective, but you had to stay on the drug for the rest of your life. And although that still would be considered an appropriate statement, we have learned that some patients that reach certain criteria may be considered for treatment discontinuation. That includes, for example, the patients that have the deepest molecular responses, what we call MR 4.5 or 4.5 log reduction in the transcripts, and that response is sustained for at least 2 years. In those instances, when treatment is discontinued, then approximately 60% of patients can maintain a major molecular response without any therapy. The follow-up needs to continue, but some of the older studies have already 5 or 6 years of follow-up. And one important study, most of these studies have been conducted in Europe and in Australia, and there is a study that's being presented here called the LAST study, which is a study from the consortium of investigators from CML that many of us are participating, led by Dr. Ihab Atala. And that it confirms the data, but it is important because it's in many institutions, all in the U.S. It shows that this is feasible. We're also learning a few other things, and there's some updates on these. For example, that there may be some immune-mediated mechanisms that contribute to the maintenance of the remission in patients who stop therapy. We also learned that there is this withdrawal syndrome that some patients may experience. Arthralgias and myalgias, we're still trying to understand why. They're usually manageable. Once in a while you have to resume therapy because that's the only thing that works. But in general, I think this is an exciting thing. I think it's important, and every abstract that deals with that underscores that it has to be done right, in the right patients, in the right context, with proper follow-up, so that we don't create a problem for patients that were otherwise doing well while on therapy.